Hello, everyone. My name is Bianca Navarro, and I am one of the Deputy Organizing Directors at Vot-ER. And today, I'm going to go over a really quick Vot-ER badge training so that you and your colleagues can prepare to use your badges to help register patients to vote ahead of our midterm elections. I'm sure I do not need to tell you the importance of helping patients use their voice to help shape policies to reflect their interests. Voting is just one tool to advocate for what we care about, but it's an extremely powerful one. And right now, with more health decisions than ever falling into the hands of local government, we need to work together to make an impact by engaging with patients and empowering them to vote. So with that, let's get started. First, to cover some important points, we're always looking for ways to show our commitment to voting rights and health equity, and registering patients with Vot-ER's help is an easy, nonpartisan way to do that. Vot-ER tools are completely optional, they won't interrupt our providers as they care for patients, and is politically neutral. So to cover the main tools we offer is first, we have the Vot-ER badge. You can see my small screen here. Vot-ER badges are an easy way for healthcare professionals to integrate civic engagement into their practice and help positively impact their patients' health. Patients scan the badge's QR code to access a nonpartisan self-service voter platform where they can register, request a mail-in ballot, and learn about upcoming elections. Vot-ER badges are free to all healthcare professionals and can be clipped to an existing ID card or worn on the lanyard that is provided. So if you're watching this video, it is more than likely that you have one of these badges that you got from a team member. So a second tool that we also offer that I want to make you aware of is posters. Your institution could order posters. It could be hung in waiting rooms, doctor's offices, and even restrooms, you name it. It could be hung anywhere that you want to hang it. And they could also be handed out with discharge paperwork. And on our website, we also offer scripts. Our voter scripts help healthcare professionals conduct nonpartisan dialogue about voting with their patients. Our voter scripts are research-backed, nonpartisan, and suitable for most clinical settings. And I'll go over a few examples later in this video. So we have the badges and the posters. They both have a QR code that could be scanned by a smartphone. They also have a text code on it. For example, it might say text vote to 34444, which could be used by any cell phone with texting capacity. And then there's also a website URL. So we can take a closer look at the badge here. You can see the QR code, the short text code, and that web URL. The text code on the badges are actually specific to your institution. This means that we can measure your impact as you begin to get patients registered. You could go to our website, Vot-ER.org, and then select track your impact. And for example, if the code on your badge was text Orlando to 34444, you could type in Orlando in that track your impact page on our website and see how many patients your institute got registered to vote. So we do not collect any personal information, so we don't have the names of those who registered, but you can see the number of folks who did. So your patients can engage with the tools in one of three ways. First, they could use their camera on their smartphone to scan the QR code. Again, if you could see on my tiny screen, that is also, again, the same QR code that's on the poster. Or they could use any cell phone with texting capacity to text the short code. And again, I'll show you if you can see. This one is Vote Health. They could text that short code. Or again, they could use any device, a phone, tablet, computer, to visit the website URL that is on the badge or on a poster. So once they do one of those three options, it'll bring them to a landing page that's pictured here on the screen. And then they could click on the appropriate option related to voter registration or vote by mail. On the top right corner, there is an option to change the landing page to Spanish so patients can engage with the platform in the appropriate language of either English or Spanish. As of right now, those are the only two language options that we offer on the landing page. Also, one of the most important things to note is the helpline on the landing page. So that is the text us button at the bottom of the screen. I'm sure you're all thinking, what if patients have questions about voter registration that I cannot answer or just do not know? Well, the good news is that your interaction with the patient should only involve inviting them to engage with your badge. Scan the QR code or text the number. Our goal is to help you incorporate civic engagement into your work while maintaining respect for your priorities as service providers and the job that you signed up for, which means that we do not expect you to walk them through the process of registering to vote or to answer any of their questions. Again, the biggest thing is that we do not want to take time out of your already extremely busy work schedule. That is what the helpline is for, is to answer patients' questions in real time with anything voting related. So we have a partnership with a nonpartisan organization called Vot-ER, whose mission is to be able to answer questions from voters and provide them with accurate, up-to-date information related to voter registration, election laws, and voting requirements. So on the bottom right of the landing page that's circled here, there is that text us button. You can let your patients know that if they have any questions related to the registration process, that they could direct chat with someone that can answer their questions by using that text us button feature on the landing page. So once they select the appropriate option on that landing page, they have those options, that is voter registration or vote by mail. You can see the form on the left is what they get if they select voter registration. From there, they are prompted to enter their name and zip code. We use the zip code to filter them to the correct state's Board of Elections, where they can then go through the process of online voter registration. As I stated before, we do not collect any of their personal information unless they choose to receive updates and reminders from us. There is an option where they can put in their contact information, but that is completely optional, and they do not need to enter that information to get set up to vote. That is only if they want our good reminders and updates. And the form on the right pictured here is what they get if they select vote by mail. It'll bring them to this form. They can fill it out and then receive an absentee ballot. So what is the service provider's role in all of this? Simply to invite patients to engage with the tools, invite them to engage with your badge, show them how to pull up the landing page, and then let them take it from there. A 20-second task of asking them if they're registered to vote and then pointing them in the direction of your badge. What does it look like to invite your patients to engage with the tools? Well, the answer is it can look like whatever works best for you and fits into the structure of your service/visit with your patient. That said, we have collaborated with voting experts and healthcare professionals to provide scripts that are nonpartisan, they are research-backed, and they are appropriate for most clinical settings. These scripts are available on our website, but I'll give you a quick rundown here. So one way to introduce these tools to patients is during the social history portion of their visit, while asking other questions such as, do you smoke? Do you drink? Are you safe at home? You could add also, are you registered to vote? You could also add this question at the end of the social history check-in, and that will sound something like this. We're all done with this part of your history, but I now want to transition to something that's really important to your health and well-being, and that's voting. Are you registered to vote? Another way to introduce these tools to patients at the end of a patient's visit. For example, this might sound like, before I leave, I'd like to check if you are eligible to vote and registered to vote at your current address. Your vote is a powerful tool to address and improve issues you care about, like your health. Local elections are often decided by a small number of voters, and the impact on your community is immediate. Through your vote, you have a say on issues like the prices of medication and the cost of health insurance that affect your friends and family. And also, I want to say that you can still use these scripts to talk to anyone about the power of their vote, not just patients. And then even if you're not a healthcare provider, but you work at an institution that is healthcare based, these tools are for everyone that work at your institution. And our quick 1, 2, 3 formula that is emphasized by the bold statements on this slide go a little something like this. First, we want to introduce the concept of voting as a powerful tool. 2, bridge with relevant dialogue about how a small number of voters can make a big difference in our local community election and resources. And then 3, Invite them to take action by scanning the QR code on your badge or having them engage with the materials in another way, like texting this code or visiting the website URL. So we really do emphasize that few votes make a difference in so many elections, especially local elections, to skeptical voters, because we know a lot of folks sometimes feels like their vote does not make a difference. It's not being heard. And a lot of people feel that way, which is why a lot of people don't vote. Well, the truth is that those in power only care about or will only listen to the interests and appease those groups of people that voted them into a position of power. Shouldn't be this way, but this is why we need to make sure we are voting. We need to make sure our communities utilize their voice to advocate not just for themselves, but also for their neighbors, their friends, and their families. We put the power back in our hands when we decide who's in power, and then our elected officials are forced to appease us and address our concerns and our needs because they know we could take them out of their position of power just as easily as we put them into a position of power. So with that, you all are taking a step to help building stronger communities and helping create a healthy democracy by using your badge to help get patients registered to vote. And why I want to thank you all first for taking the time to watch this video, but also thank you all for doing this extremely important civic engagement work. Before I end this video though, I do want to ask you all to take action today and commit to asking 5 patients if they'd like to get ready to vote by scanning your badge this week. Remember, the more you ask the question, are you registered to vote, to patients, the easier it'll become. We need to practice, and you need to start practicing by asking patients today if they would like to get registered to vote. So if you need any support at all, please contact your team leader working with Vot-ER, or contact your state organizer that is your Vot-ER contact. My name is Bianca Navarro. I would be the contact person for all my Florida folks. You can find that information from your team leader if you need to find who your state organizer is. But with that, thank you all for taking the time to watch this. And let's remember, vote like our health depends on it. Thank you, everyone. Have fun using your badges.